This video is a quick walkthrough of the application questions to determine if a client is approved and if they are day one coverage or modified, and then I will also review the difference between day one coverage, which is final expense or 20 pay, and a modified plan. So you'll see that basically our application is just yes/no questions. The first is a rate question, whether or not they have used tobacco in the last 12 months. So it's going to be yes or no. The next two questions, the uninsurable condition questions, are going to determine if they are approved for a policy or not. The first question: has the applicant tested positive for HIV or been diagnosed by a physician as having AIDS or a life expectancy of 12 months or less? Yes or no? You'll notice on these two questions, if you answer yes, they do not qualify for a policy with us. The second question: is the applicant currently bedridden, hospitalized in a care facility, or receiving hospice care? So again, they are required to answer no to both of those questions to qualify for a policy with us. The next set of questions, the significant health condition questions, are if the answer is to any of the health questions is yes, the policy will be modified. These are only in the last 2 years has the applicant been diagnosed with, been treated by a physician, or taken medication for any of the following conditions. First is disease of the heart, including heart attack, heart surgery, or congestive heart failure, yes or no. On this question also, I like to ask the client if they are prescribed a blood thinner or nitro. Blood thinners are typically the most common medication that we see that people are prescribed that will make them modified. If they are on a blood thinner, most likely they've had either heart disease or disease of the circulatory system, including stroke, aneurysm, or been advised to have surgery to improve circulation. The next question is related to cancer other than basal cell skin cancer. Disease of the lungs, including COPD or emphysema other than asthma, is the next question. The next one is disease of the liver or kidney or had an organ transplant. Next we have Alzheimer's disease, dementia, organic brain syndrome, or ALS, known as Lou Gehrig's disease. A note on this one is if they are a yes on this question, they will be required to have somebody else be the owner of the policy. They can still qualify for a policy, but most likely it will be the beneficiary or a spouse or child or somebody that's in their life that helps them with their daily activities. Next is alcohol or drug abuse. And the last one is complications of diabetes. They can be diabetic, pre-diabetic, but if they have complications like amputation, diabetic coma, blindness, or kidney disorder, then they will be modified. The last question: has the applicant had or been advised to have a diagnostic test relating to any of the questions listed above, except for those related to the HIV or AIDS virus, for which results have not yet been received? What that basically means, and the easier way to ask the client is, these questions I just went through, have you had a doctor tell you we need to test you further, or have you had any recent tests that we're waiting on results? So if they answer no to any of those questions, they will be what's called a full benefit plan, which is day one coverage. If they answer yes to any of these, they will be on what's called a modified plan. So here's the difference between a full benefit plan and a modified plan. Full benefit means whatever amount of coverage they take for natural death benefit, if when they die after they start that policy, it will pay the full benefit. The minimum amount is $1,000. The max that we do is $35,000. There is no health examination required, so we're not like some companies where we send a medical expert in later to have them do a stress test, weigh them, measure them, take a urine sample, or have them give blood. It is full benefit from day one, so whatever amount they take when they start that policy, when they die after that, it will pay the full benefit. Also, our benefits do not decrease. Some companies down the road, 5, 10 or so years later, they may decrease the amount of payout that the policy will pay, or they may raise the rates. Our policy is locked in based on when they start that policy, and it's based on their age and their health at that time. So we do not decrease the benefits, and the rate will never go up. And to note, If their health changes after they start their policy, we do not cancel the policy or change anything based on age or health. So a full benefit plan is going to be day one coverage. It's listed in our policies as FE for final expense, or if they do a 20-year pay, that's also a day one policy. If they answer yes to one of these questions, they will be on what's called a modified death plan. Some companies call it guaranteed issue or graded. This is for people with significant health condition questions. This is a very good plan, and it's a very good thing because a lot of times when folks have one of these conditions, they are actually being turned down by other companies. So with us, most people get coverage even with significant health issues. Something to note is the max amount of coverage we can do is $15,000 on a modified plan. So the minimal is $1,000, the max is $15,000. Again, the rates never go up, and there is no health exam required, and the benefits are paid out based on the age of the client. Excuse me. So if they are 50 or older and they die of natural causes in the first year, we will return their premiums, their monthly payments, plus 10% on top of what their monthly payment is. If they die in the second year, we return the premiums plus 20%. This is very good because many companies, if they are on a guaranteed issue, modified or graded plan, however they label it, and they die within the first couple of years, or maybe 3 years, some companies only return their monthly payments. If the client happens to have one of these conditions and they are 49 or younger, there will be a third year on their waiting period, so it would return their premiums plus 30%. One thing to note during these waiting periods, and the reason we always include accidental death benefits, is if they die in an accidental death during this time, for example in a car accident, we will cancel the waiting period, pay the full amount of the policy, the face amount for natural death benefit, plus on top of that, pay the accidental death benefit based on the type of accidental death.